Hello everyone, welcome to LAMP lecture series featuring 5 SHU points, the Jing-River points. This is presented by LAMP AccuWellness Foundation Inc. The point at which the chi flows is known as the Jing-River. The Jing-River points, Jing means to pass through, are situated at or proximal to the wrist and ankle joints. Jing-River points are also known as the traversing points. Here, there are fairly clear separations between tendons and muscles that are large enough to accommodate the steady, large, and deepening flow of qi in the channels, which classical physiologists compared to a river. Because the qi is truly moving at the river points, their stimulation provides a burst of channel qi that can help force exterior pathogens out of the body. It is the sheer force of the movement of qi at these points that accounts for their effectiveness in clearing the surface of external pathogens. Again, the force here is still along the relatively superficial layers of the muscles. In general, the clinical applications of river points reflect their ability to promote proper movement. Jing-River points are indicated for cough and dyspnoea, chills and fever, diseases manifesting as changes in the patient's voice, and diseases of sinews and bones, the Jing-River points of yin channels. An example of promoting movement to release the exterior is the use of Long 8, Jing-2, to treat invasion of wind cold with symptoms of coughing, body pain, and fever, accompanied by a lack of sweating, excess exterior condition. The effects of the point are slightly modified when combined with the spring point spleen 2, Tadu. Stimulation of these points, lung 8 and spleen 2, acts to release an exterior pathogen outward, where there is a slight underlying Tai-yin deficiency, a fairly common situation. The river point, lung 8, moves the channel qi to force the external pathogen out of the body, while the spring point of the spleen channel, spleen 2, helps to clear heat from deficiency. Together, lung 8 releases the Tai-yin lung, while spleen 2 acts to clear heat from deficiency by gently supporting the Tai-yin spleen. Each of the points clears a different type of heat, and together they are quite effective in helping deficient patients get over a persistent, unrelenting fever. Note that while the spring points are sometimes used on their own to treat low-grade fever due to heat from deficiency, this pair is effective in cases where a high fever refuses to break. The important diagnostic marker is that the patient is unable to sweat. The effectiveness of this point pair lies in its ability to initiate the removal of pathogens by inducing sweating. The treatment technique in such cases should be fairly strong twirling of the needles. Some of the river points are hard to fit into the classic of difficulties mold of treating wheezing, coughing, heat, and cold. For example, a commonly used point like triple burner 6, G-Go, does not have the same ability to release the exterior as the nearby triple burner 5, Y-Quan. In general, triple burner 6 is a point for clearing heat in the channel. The point is also familiar to many as useful in treating constipation, specifically the type associated with stasis of qi combined with heat in the liver and gallbladder. The river point on the Shaoyang channel clears this constrained heat from all three burners. In the clinic, triple burner 6 is often paired with gallbladder 34, Yang Ling Chuan, to dredge and drain the Shaoyang channel. By combining the regulating action of a sea point with the moving action of a river point, the net result is to dredge Qi-Shu, the Shu Yang. By contrast, kidney 7, Fu Liu, another river point, largely acts to strengthen the yin. Unlike kidney 3, Tai Si, which stimulates the qi dynamic of the kidney organ by facilitating the flow of source qi, kidney 7 strengthens by moving. In the case of the kidney, a yin water organ, the provision of yin sometimes requires an extra boost of movement. Note as well that the 5-phase categorization of kidney 7 associates the point with metal, the mother of water in the generating cycle. It therefore has a slightly more tonifying effect than other river points. The proposition that the Jing-River points are effective for treating cough and dyspnea derives from the status of the Jing-River points of the yin channels as metal points. The lung pertains to metal. Hence the observation that they treat lung pathogen. There is some evidence, however, that Jing-River points of both the yin and yang channels have an action on either coughing and dyspnea or chills and fever. Jing-Shu, lung 8, cough, asthma, wheezing, dyspnea, febrile disease with absence of sweating, febrile disease with breathlessness. Yang-Qi, large intestine 5, cold cough, fever with absence of sweating. Jie-Si, stomach 41, febrile disease with absence of sweating, malarial disorders. Shang-Xiu, spleen 5, chills and fever with vomiting, coughing, and diarrhea in children with no desire to eat, cough. Yang-Ku, small intestine 5, febrile disease with absence of sweating, chills, and fever. Kun-Luan, bladder 60, dyspnea, cough, malaria with copious sweating. Fu Liu, kidney 7, fever with absence of sweating. Qian-Shu, pericardium 5, aversion to wind and cold, febrile disease, malaria, obstruction of qi following wind stroke, leading to impaired breathing. Qi-Go, Sanjiao 6, cough with redness and heat of the face, febrile disease with absence of sweating. Yang-Fu, gallbladder 38, chills and fever, sweating with cold shivering, malaria. Diseases manifesting in the patient's voice. This kind of indication is frequently found for the Jing-River points. Yang-Si, large intestine 5, manic raving, propensity to laughter. Jie-Si, stomach 41, stomach heat with raving. Qian-Shi, pericardium 5, loss of voice, halting, speech, manic raving as if seeing ghosts. Shang-Xiu, spleen 5, stiffness and pain of the root of the tongue, impaired speech, propensity to laughter, cold body with much sighing. Ling Tao, Heart 4, sudden loss of voice. Fu Liu, Kidney 7, curled tongue with inability to speak, propensity to anger with incessant talking, propensity to laughter. Chu Ko, Sanjiao 6, sudden loss of voice. Yang Fu, gallbladder 38, sighing. Jung Feng, liver 4, sighing. Diseases of sinews and bones. Several of the Jing-River points have an important action on the sinews and bones, and this is not confined to the yin channels. GSC, stomach 41, sinew painful obstruction, dump painful obstruction, atrophy disorder of the leg. Shang Xiu, spleen 5, pain and contraction of the sinews, bone painful obstruction, heavy body with painful joints. Ling Tao, Heart 4, cold bones and marrow, clonic spasm. Yang Gu, small intestine 5, lockjaw, stiffness of the tongue in babies preventing suckling, clonic spasm. Kun Lun, bladder 60, stiff neck, contraction of the shoulder and back, lumbar pain, sacral pain, pain of the coccyx, heel pain, ankle pain, lockjaw. Fu Liu, kidney 7, cold and hot bones, atrophy disorder of the leg. Yang Fu, gallbladder 38, wind painful obstruction with numbness, wandering pain of the joints, hemiplegia, contracted sinews, pain of the 100 joints, that is all the joints, lower limb painful obstruction, severe lumbar pain like a small hammer in the middle of the back, pain of the lateral malleolus. Jung Feng, liver 4, contracted sinews, lumbar pain. In summary, for the river points in particular, it is important to consider the net effects of moving the channel qi on the qi dynamic of the organ and or channel. Because these effects are quite varied, the indications for the river points may be quite different from channel to channel. As always, the functions of the points described in the Classic of Difficulties must be considered in context. Techniques for treating river points. Techniques should reflect the fact that the qi and blood are moving more rapidly at the river points. Specifically, slightly stronger techniques are indicated. To obtain qi at a river point, one might utilize the scratching or flying techniques. The goal should now be focused on initiating movement in the channel and less on creating the gentle radiation that is important at more distal points. To that end, longer needles can be used where appropriate, with less twirling and more lifting and thrusting. Thank you very much for your attention, and see you in our next videos.